right, we are back with another clinical conversation. This time we're talking about board specialist certifications. We have Leanne Yaney, who is just overcoming another wonderful experience with passing this exam, it sounds like. So she's going to tell us everything there is to know about that journey. And of course, we have Ashley Langford, who is our Director of Clinical Excellence at Cora Physical Therapy, and he's going to help me to moderate this. And yeah, we're going to kind of take it away by, I want to ask Leanne first, what brought you to pursue this the first time? Because now you've passed the exam twice, the orthopedics specialty, the OCS. And so what brought you to do it the first time, and then what compelled you to do it the second time? And I'm going to ask probably questions in between, but here we go.
Well, first off, thanks for having me, guys. Why did I take it the first time? So I took it the first time. I'd been a clinician for about 10 years, and I was like, okay, I need to do something different. I need to up my game as a clinician. 10 years in, you start to kind of do things redundant. You just kind of keep doing the same things. So I decided to, while I was working in Boston, a couple of my coworkers and I just said, all right, let's do it. So went through evidence in motion, printed out numerous pieces of paper. My goodness, I don't think I've ever studied so much in my life. And then you kind of go into it and you fingers crossed. So I do like how you have been put this into the universe that I've passed the second time. Unfortunately, I do not know if I passed until the end of June. So it's a extreme waiting game, but I will take it. But it just makes you a better clinician ultimately. And I think that was what piece I was missing as even a clinician in 10 years out. How could I be better to make not only myself quicker, but my patients better?
So it sounds like you kind of hit a plateau. You were treating 10 years in, you're kind of feeling like, all right, there's more to this. Like I can unlock more. I need to pursue this next level, sir.
Absolutely. Because even with our continuing education, right, we have 24 credits every 2 years. You tend to focus on things that you enjoy. You tend to shy away of things that aren't super interesting. So I feel like the OCS really makes you that overall clinician from literally head to toe. And how can you be more efficient and not take the initial, like, I'm a clinician, I'm going to do all 16 special tests, I'm going to do this, I'm going to look at that. Ultimately, you're taking what they're saying, you're sifting it through these different patterns and saying, that's what I'm going to go with first. If it works, cool, you're on the right track. If it doesn't, you know how to pivot a lot more quickly than a new grad or somebody that isn't more focused on what things should look like.
You chose 10 years into treating. How long before maybe others? Do you wish you did it sooner, or did you feel like that was kind of the sweet spot?
For me, that was a sweet spot. I've also always been a clinician that has played it more safe. I never felt comfortable. I never felt smart enough to take it because it is such an insane exam. I mean, was it 4 out of 5 people passed? I think out of the 5 of us, 4 of us passed, 1 didn't. Like there's some statistic to it. So it's not a super easy test. And I just didn't feel like I knew what I was doing as a clinician, even 10 years in. But I think I kind of got the kick in the pants dealing with some of the therapists that I was working with up in Boston as well. And that kind of just gave me that little extra nudge.
I'll say too, because like obviously for many of us, when you think about the practical side of real life and what are you pulling, and then there's the test taking side and knowing, look back, I don't know if you disagree, Leanne, but like there's so much content to know, and the way that they ask questions, like you described it very well, like you've got to like pull things together and really make the best decision possible, which is what you're doing in the practical world. I do think this exam was less about test taking skills and more about, can you cram the knowledge that you need to into the thick skull and then be able to make sense of it well enough to go the route that you should in that decision. It really has a practical element to it.
I think, Adam, going back to what you were saying, like, should you take it earlier or should you take it later? I really think it's up to the therapist. Again, here at Core, we have an amazing OCS residency program. So these folks are coming through that 18-month program and then taking it. I don't think I could have done that. I didn't have the opportunity when I came out of school, but I don't think that would have been for me. I feel like it would have been too intense. For me personally, I wanted to get my feet wet. I wanted to get my clinical hands dirty and kind of see what worked. But yeah, I think it's really up to the clinician and the new grad that comes out. If they feel comfortable jumping in, they have an opportunity to go through an OCS program, great, go for it. But for me personally, it just wasn't my thing.
Well, I'm hearing this a lot lately. We don't know what we don't know. I think that goes for everyone. What would you tell people that probably don't know? Why should somebody not? I'm going to kind of flip it here. Why should somebody not pursue the OCS or any board specialist certification?
I really can't think of a good one not to be honest with you, because it truly does, like Ashley said, even if you don't pass, the amount of information that has just been crammed into you only is going to make you better. The OCS, I don't want to dumb it down, but it was just letters, right? So I could have just done this 6-month journey. I was just on a dedicated path of learning specific things. It is very stressful. It is very time consuming. The first time I took it, I didn't have a child. I was married, but I didn't have a child. Second time I take it, I have a 7-year-old. So time to study has to be a family, event. And I'm sure Ashley can attest to that as well. I'm working all day. I come home, I have stuff to do as a senior clinic manager. I'm doing that stuff and I'm studying. I can tell you, getting on a bike and listening to stuff on my iPad, stellar. It's a lot harder to exercise right now on that bike because I don't have something to have to study. But so time consuming, just overall stress would be, in general, I would say a reason to not take it. But if you go into it and saying, now I'm 20 years out as a clinician, I'm that much better having these past 6 months than I was previously.
And okay, so it sounds like a great time. What about the content? Talk to me about the content. Maybe if somebody doesn't know, if you're a clinician, do you know just generally what's involved as far as the content goes of this certification? And if not, what is involved?
Yes, so ultimately, this is all stuff that you've learned back in the day in PT school. It is just more refined. So you truly are taking something from the TMJ, so the jaw joint, all the way down to foot and ankle, and you're taking anatomy. You're taking, any clinician, you say brachial plexus is going to start twitching. I had to learn how to do that all over again 10 years later. It's rehashing a lot of stuff from the basics to, okay, if I take this test, this test, that says I have a probability that this patient has this. So then you're learning all of that piece of it. And again, combining not just, I'm going to do every test under the sun for this, and I'm going to do every test under the sun, and I'm going to hope that it equals this. All the really smart people that do all this research, now you're taking all their information saying, hey, thanks for doing that. I'm going to take all your information and know how to treat and get my patient going sooner. And it's literally doing that for every single joint.
I also think too that depending on when you take it in school, what's nice about it is, like, in our profession, like many 5 or 10 years later, a lot of things change. The research behind the best approach to treat an Achilles issue or tennis elbow or whatever it is does shift and adjust. Taking yourself through the journey to prepare for the OCS does mean you need to be up to date on the most current knowledge. I was 14 years out, and the clinical practice guidelines, which just alone, there's enough of them. They're updated. Like, that's the Bible of like how we should be moving forward with treatment in our profession. I would say that I run into enough people that aren't really either familiar with like some major things such as CPGs or CPRs, or they know about it, but they're just, rightfully so, if you're not investing time into it, it's hard to keep up with.
What about, you guys are physical therapists in the outpatient setting, and then there's physical therapists in the inpatient setting, and then there's physical therapists in other settings. Is this appropriate for any PT in any setting, or is it kind of more of a outpatient orthopedics? Maybe I don't even know what I'm talking about, but help me understand.
No, it's a great question. I would feel that it's more appropriate for outpatient. Different things, maybe like geriatric or neuro or pelvic floor, might be appropriate in those other settings. But because it's so emphasized in, like Ashley was saying, with the clinical prediction guidelines or the rules, you're not going to typically see those things or be assessing those things like in an acute care or an inpatient. Just background and the outcomes of what you're going with those settings are going to be different than the outpatient. But other ones, very similar, just in those settings. But as far as the OCS, I feel like it would be more appropriate for outpatient.
Do you plan on getting any other?
Well, since this is on tape, I would really like Ashley Langford to fellowship train me. But I have my athletic training certification back when I was in PT school. SCS and OCS, they were kind of like, if you have your athletic training certification, like SCS is very similar. I've been out of that game way too long now. You have to have certain on-field hours and stuff like that, and I have not touched an athletic training field in 20 years. So no, I am very happy with OCS ×2, and I just keep filling my knowledge base with what we have here.
Okay, maybe next step is fellowship. That's like a next step. I don't want to talk about that, but maybe that's another conversation for another time. So that would be maybe next notch in your belt.
To start before going to the next, for OCS, I might be missing one, so correct me, Leanne, if I'm wrong here, but like generally speaking, individuals will either put in so many hours and time to meet the requirements to sit for the OCS, and they do that on their own, right? Again, you want it probably a minimum of 6 months to prepare for that. Not to mention that there's required for the sign-up time anyway. And then others will go through like a residency program, like an orthopedic residency, which is that a structured program of learning and mentorship, which in turn helps to prepare you to take the OCS, right? So those are the two main routes. And then fellowship. So residency would be for a specialty like orthopedics. Fellowship is mentorship, but it's for a subspecialty like manual therapy. So if you've gone through, so the typical route would be you either go through residency or you sit for your OCS. Now you are an expert in orthopedics, your soft tissue, your musculoskeletal, and then you decide, all right, I'm crazy and I want to do even more. And at that point, fellowship would take you down a path of structured hours, like it's another 150 hours, I believe, of one-on-one mentorship and 1,000 or 2,000 tracked hours where you're really putting a focus on, can you effectively perform mobilization or manipulation on a joint or soft tissue. It's just taking it that extra step.
Sounds awesome too. All right. Anything we're missing here in this conversation about, well, mostly it seems like about the OCS, but we're talking generally about just board specialist certifications. Anything else you want to add that I didn't ask?
Right now, obviously, like we can't give any details on questions and stuff like that, but was there a certain topic that kind of threw you when you sat for obviously you'd spent months preparing, you're already an expert because you passed it years ago. Like, was there anything that still shocked you? Like, wow, I didn't know this.
It's funny because you go into it, you're like, all right, I have all this stuff in my head, and you take countless practice tests, and then you sit and you're just like, I think for the first 3 questions, it's the way it was broken up was 4 90-minute sections. So it's a 7-hour total test. And I'm pretty certain that I sat for the first one and I probably took 2 or 3 minutes just staring at it and reading it, because you get so used to all right, I have this amount of time, I have to go through it. I don't think there's anything particular. Everything gets jumbled. You're like, no, I know I studied this. They tell you in different studying patterns, write down the brachial plexus the moment you get in there so you can reference it. I think I used it twice the entire 6 hours that I took the test. It didn't just, you get out of it and you're like, no, I remember this question, but then that question melds with this question. I would say this time around, I felt better coming out of it than I did the first time. However, you just walk out and you're like, what did I just study for? I studied all of this stuff and I feel like none of it was on there. Yeah, it's just amazing. Statistics is not my strong suit. And I could tell you, I felt like there were 100 questions on there. There probably were 5 to 10 out of the entire 200, but for me, that was every other question. I was like, no more.
It's the marathon of exams, right? The 6 hours, because it's not like you can step away and go get lunch. You're starting at 8 and you're finishing at least from my experience, finishing at 2:30 or It was the only exam in my life I have ever got to the end of a section and I ran out of time. There were still several questions that I'm just this is not good. So then you're questioning everything about who you are as a human, but just every single question is, you've got to really kind of think through it and kind of wager, what is the best answer that they're looking for here, which again is cool in a sense because that's real life, right? For the patient in front of you, you got to figure out what's the best decision I can make here and then reassess.
Yeah, and that's the thing is you get it down to, out of 4 options, you can usually nix 2 of them, at least one of them right away. You're like, yay, I know it's not this one. And then you look at it and you're like, but okay, this and then this. And what I can tell you, having done it out of school 10 years versus somebody that's doing, say, the OCS residency or somebody that's a newer grad, you have to make sure that you remember this is all about what you've learned and what you've studied and not real life, because you may learn all this information and that ultimately if somebody has low back pain, they just need to move. 9 out of 10 times, they just need to move. Well, if they fit in this category and they give you this answer, but this answer is better because that's what the clinical prediction guidelines said, you have to almost forget everything you've done for the last 10 to 20 years and say, oh, okay, this is what I should be doing because this is what the book says to do. Almost like new grads that come out and are on temporary licenses, for example. You know, I'm like, go into it and forget everything you've done in the clinic. Go back to your books, pretend nothing ever happens because it's all about what's in the books and what you've studied and in the research. And then, like Ashley said, you know, real life is very similar. You hope to go down the right path and it just helps you pivot a lot more quickly when you have your OCS.
Adam, another interesting thing too, I think for those that are maybe interested in going the route or is the experience of like when you start taking practice exams. And I don't know if you want to kind of share for those that haven't done it, prepare them what, you know, regardless, I assume, of any of the companies you go through, how can you prepare someone for these practice exams?
Find really good friends that will deal with you for the entire 6 months. When I took it the very first time through EIM, I want to say, because I think it's still doing other courses, had my score, and I want to say it was like a 41%, maybe it was even less than that. And it's a shell shock. You're like, what are you talking about? Like, this is going to go very badly. So fast forward 10 years later, I'm taking it. I'm not even thinking that it's going to take me that long. Why? Because I forgot how it was 10 years ago. So my family were down to go putt-putt golf at Disney, and I'm taking the course on my iPad, you know, the test on my iPad, 100-question quiz, and I get a 53. I immediately screenshotted it, and I sent it to Ashley and Alex Swanko, and I said, oh my God, this is not going to go well. Alex's immediate response was, that was great, followed by Ashley like, oh my God, that's amazing. Like, what are you guys looking at? I just scored a 53. And then, you know, the way MedBridge has it set up now, they've done some partnering with OCS Field Guide, which I did not have the very first time. They weren't around. They hadn't had their OCS at that point. They're phenomenal. I took MedBridge and they have you go pretty much like halfway through, then you take another midterm. And I think I scored like a 67. And I'm like, whew, this is amazing. I'm just doing great. And then you take another test, that third one. And I was like, oh, we're back into the upper 50s. Okay, this, you know, you start to feel like more confident. And then that fourth one, you're just like, okay, I think I got a 63 on this last one. And again, I got my hype men and women over here, like, they're just like, good job. And I'm like, I don't understand what you guys are saying. Like, what are you seeing? But they ultimately make it that challenging for you so that you really, it's more, these tests are more honestly to find out what you're really deficient on and what you can maybe not push too far into. Like, I really want to make sure I learn more about this, but man, my score in this is way lower. So I would go back and read some of that stuff. I would take those practice exams. It's a lot about repetition and finding different avenues because you do get test fatigue with reading those questions. You're like, ooh, I remember this question. I remember how this is going to be answered. So finding different avenues of ways to take them ultimately is going to just get your brain thinking in different ways.
What is the passing grade?
Like, what score do you have to get?
Yeah.
It varies because what they do, and that's the whole process with it too, when you first take it. So you sign up for it in June, you find out if you got accepted to take it in September, then you sign up for your test in February, March, and then you find out if you passed in June. So it truly is like a whole year process from start to finish. But I want to say it's like, I've heard like 65 to 70-ish% is kind of like the passing. But they ultimately take all the scores. They say who got what, where did you fall into the bell curve? And it does also depend on who you took it with, right? So if everybody thought the same way as you did and you fall under that curve and that's what they also deem as appropriate, then you get the answer right. If you fall out of the curve or if there's too much variance, then they'll throw out the question. So you may have gotten a question quote unquote right, but it was too spread out and that question just got thrown out. So I've heard things from people that if you like were able to take these like test score or like the pre-test and get into the 60s, like low to mid 60s, like you're in good company, but it's so variant.
You know what's interesting too, like
that
this is
the way they score your test. Sounds pretty interesting. Sorry, Ashley.
Well, the whole philosophy too behind this isn't specific to OCS, but I would say like the medical field in general. So let's take physical therapy school. As you're going through schooling, you pretty much have gotten accustomed to, exams and learning is like you got it right or you got it wrong. And then you get to physical therapy school and you have to kind of learn to be comfortable with the gray, right? Like you're going through kind of learning to where it's like, there isn't really a black or white answer with human beings and which way to navigate with treatment. So it's like taking that decision to say, okay, this is likely the best decision out of the three because of this. I was listening to a podcast recently about the challenges physical therapy schools are having just in general with helping students become accustomed to that style. So the OCS is the mecca for that world of gray.
Well, hopefully they listen to our podcast and that will help sort out the gray. All right. Anything else that we haven't discussed here? This test sounds awful, by the way.
Yeah, we've completely convinced everyone not to do it. Seriously, I think my personal experience when I took it last year was I didn't care if obviously I wanted to pass it, but even before taking the exam, pushing yourself to learn, to go to those areas where you're not comfortable. I think Leanne said it right. The passive route for everyone naturally is to go take what you enjoy, what you love, and there's nothing wrong with that. But this board specialist certification allows you to, or puts you in a position to be uncomfortable, most likely in certain areas that will help you in the long run with your decision making as a clinician, your confidence, and ultimately helping the people that you're treating. So highly recommend it, but I wasn't expecting this from the call. I would say I love the concept of when is it appropriate for individuals is going to be totally up to that person and what's right for them. So
what about resources, study prep resources? Do you have any recommendations if you're getting into this, your top resources that you leaned on and maybe heard from others that they recommended, etc.? My wife took the CFP, Certified Financial Planning designation exam, probably most recent out of what we've done. But anyways, in her journey, she had some great recommendations, and then she tried some things that just didn't work. And I know everybody has a different learning style, but what did you guys find that worked the best?
With Cora, I have MedBridge, and that was the first time that I had done the MedBridge OCS Prep. Like I said, I did evidence in motion previously. I mean, I did well with that. There were things that pros and cons with MedBridge and taking their quizzes, but overall, like I said, it was more designed to make you know what you had to kind of dive in a little bit more to. One thing that I was turned on to through MedBridge and then through Alyssa and Alex and Ashley was the OCS Prep, the field guide. These two guys have a podcast, and then they have another facet that you can be a different level of a supporter. And it was only $15 a month to be able to have access to all their study information. If you were at like the highest level of supporter, which honestly was like only $25 a month, and you don't need it like all the time, kind of thing. You can be a part of their like live, like big test, kind of like open questions. They create their own test questions. They're really smart. They're really funny. Like I said, I popped my earbuds in. I rode the bike. I literally took a picture. I showed Ashley and Alex. I was like exercising. I had my iPad like on my side desk, and I'm doing stuff while I'm listening, because of course that just brings the blood flow and the good stuff to your brain. So that helped me a lot. I thought that was like super cool. I would listen, I would write, because for me, I'm old school and I would have to write things out to make sure I'm like following back on. I've heard of other test study items, but for me, having the MedBridge to start with and then the OCS Field Guide to kind of supplement. I tried books. It was terrible. It was like the questions were nothing like of what I had studied up to that point. So it was just more nerve-wracking, and I just put it aside. Mm-hmm. But yeah, that's how I studied. How about you, Ashley?
The MedBridge, I thought that the quizzes were good. As far as the studying and learning through them, I don't know that I thought it was like the best, but I love the fact that you could kind of passively absorb it too, and it was easy to put on, and it would save where you were. That was awesome, and that is primarily what I used. The OCS Field Guide, and then honestly, if you're looking to move forward with this, find someone who's taken it before. And this, like within our company, there's enough people that have taken it, and you get to talking with them, and they've put together their own. Some of them put together their own notes that are digital. They're willing to share it with you. One that I haven't used, not familiar with. I mean, I hear positive things about Final Frontier as well as a company study. There's plenty out there. I would say in general, no matter who you go with, particularly if you can talk to someone about like what are the key things to review and study early on, it's just putting the time in, looking at it however you can memorize best, whether that's writing it down, it's just putting in the time. So, yeah.
All right. And shout out to Leanne for being here, but also I liked how you were saying you're taking pictures and sharing them with Ashley and Alex. And I feel like following you on LinkedIn, I see a lot of your situations as well at home, at work, and it's always it allows you to see through somebody else's lens sometimes, and I appreciate that. You do a good job with that. Shout out to your content creation.
Yeah, absolutely.
All right,
Yeah.
Final words?
I don't know. I feel like we're gonna have an update in 6 months. I'm a little nervous on that, like an OCS reveal.
If you want an update, check Cora LinkedIn sometime around June.
End of June. I'll show you on my cruise.
If you don't see anything, don't ask.
Leanne, thank you so much for being on the call. You're a warrior. I know there's nothing that couldn't be thrown at you that you couldn't just handle in strides, make it look easy. So you set a great example, and we appreciate you being here.
Thank you, Ashley.
Thanks for being here.
Thanks, Adam.
See ya.
Bye, guys.